The story of healthcare is about people with a passion for making a difference. They know that if they do it right, they can save and improve lives, and they can leave a legacy of a better healthcare system for their children and for future generations. Well, here's the good news and bad news. So the bad news is that healthcare has some big problems. But the good news is that right now, there's a lot of opportunity to help. Speaking of news, one issue that has recently become front page news is the cost of healthcare. Why? Because the cost of care is spiraling out of control, and it is unsustainable. 1 of every $5 in the US is spent on healthcare, and 1/3 of that spend is considered waste. That's $2.7 trillion spent and over $800 billion wasted. And currently, 1 out of every 3 hospitals in the US is losing money, and things are only getting worse. That's a problem because hospitals need to be able to perform financially so they can continue to invest in their mission of delivering safe, high-quality patient care. But this critical and central part of the healthcare system is facing a perfect storm. Decreasing patient volumes, declining reimbursement, increasing competition, unfavorable payer mix, increasing burden on patients, and the movement of reimbursement into a model where the amount a provider makes is either bundled or capitated. Remember, we said there was some good news, and there it is. The sky is starting to look a little brighter. There is a growing movement of healthcare providers that have chosen to make a difference and have begun to shift their focus from volume to value. To thrive from a financial perspective, hospitals are starting to shift from a revenue cycle management approach of growing their top line to margin and outcomes management and improving their bottom line. In order for this shift to work, all hospitals and healthcare networks must get the cost of healthcare under control. But that's really hard, considering cost information is hard to come by. Here are a few quotes from a recent Harvard Business Review article that highlight this problem and a potential fix. Understanding true costs will finally allow clinicians to work with administrators to improve the value of care. We agree. At Strata Decision Technology, our cloud-based platform is used by 1 out of every 5 hospitals in the US to help manage cost and drive margin to fuel their mission. How do we do this? We provide the industry's most sophisticated financial decision support and cost accounting tool to help hospitals and health systems understand their true costs to improve the value of care they deliver. We help them identify variances between physicians and service lines. We help them evaluate the cost and understand their true margins across an episode of care, service line, or population. This helps them survive and thrive as reimbursement becomes increasingly capitated. And we help them use this information to create a more solid long-range plan and budget to provide the clarity of where they need to head in the future with the operational control they require today. To make this happen, we implement our solutions quickly and integrate them with existing enterprise resource planning and electronic health record systems. We host the solutions with no hardware or IT resources required. And most importantly, we guarantee it will work. So it's time to write a new story. It's time to take action. It's time to make a difference. It's time for Strata Decision Technology.